Welcome to our Enhanced Recovery presentation. If you've been asked to watch this YouTube clip, then you will be planning on having a total hip replacement. My name is Sarah and I'm an occupational therapist. I have my colleague Karen, who is a therapy technician, with me. Together, we are going to take you through some of the things that you need to know prior to having your hip replaced, especially regarding the therapy treatment that you will receive. Besides watching this presentation, you will get to speak to one of the therapists prior to your surgery. This is to go through details specific to you, and it will also be an opportunity for you to ask questions. During this contact with you, we will identify if you need any equipment at home, such as toilet frames. Any equipment identified will be ordered for you and is on free loan from the local equipment provider. During this presentation, we are going to talk to you about the things you can do at home to reduce risks, about the Enhanced Recovery Programme, and a little about your operation. We will explain what your expected progress is likely to be. There are some movements we want you to avoid for 6 weeks. They are called hip precautions. Finally, we will cover your progress once you return home. When preparing your home prior to surgery, we would advise you to remove any rugs and mats and move any trailing wires to ensure that you have clear pathways around your home. If you have items on low shelves that you regularly use, then we would advise you to move them to a higher position. If you tend to get up during the night, then make sure you have a lamp by your bed within reach. Think about how you will manage your meals at home, especially if you live alone. Now is the time to be stocking up on food or cooking extra and freezing meals in preparation for your discharge. We advise you to avoid carrying heavy shopping or using a heavy vacuum cleaner. If you think you will need help on discharge, then you will need to organise this. Our expectation is that you will be able to move around and look after yourself on discharge, and so we would not be arranging care for you. Please also plan for a friend or relative to accompany you home from hospital for when it is time for you to be discharged.
When you have a date for surgery, you will need to pack for coming into hospital. It will be important that you get yourself dressed, as you are not ill but recovering from an operation. We advise you to bring in loose, comfortable clothes, as you will be sore and likely to have some swelling around your hip. Please bring enough night and day clothes for your stay, which will be approximately 2 days. Please also bring in a pair of supportive shoes or slippers, ideally slip-on or Velcro fastening, that have a supportive back to them. We would advise you not to bring new footwear for coming into hospital, but to bring in footwear that you have worn at home and that isn't too tight on your foot. If you currently walk with a stick or frame, then please put your name on the walking aid and bring that in with you, along with your information booklet. Enhanced Recovery is an evidence-based approach that we follow, which helps speed up recovery after surgery. The team will be making sure you are as healthy as possible prior, during, and after your operation. The earlier you get out of bed and start walking after an operation, the shorter the recovery time is likely to be. Enhanced Recovery is about making you more active in your recovery and ensuring that you are better prepared to manage once you are back at home. You will have received a letter telling you where and at what time you need to come into the hospital for your surgery. You will be seen by your surgeon and the anaesthetist, and when it is time for your operation, you will be taken to the anaesthetic room and then into theatre. After your operation, you will be taken to the recovery room, where you will be monitored until you are taken to the ward. You will be up and sitting out of bed on the same day, aiming for this to be in time for your next meal. The nursing staff have been trained to assist you with this. Your aim is to start walking with a frame to the end of the bed or to the bathroom. While you are in theatre, your surgeon will inject pain relief to target the area around your hip. So when you come back from theatre, you should have good pain control. You will be given routine pain medication during the day. Extra pain medication is also available, but you will need to ask for this. You will find that a change of position can help ease the pain, and also mobilising as soon as possible often helps.
Before we tell you about what happens on the day after surgery, let us tell you about hip precautions. This is about how to look after your new hip. To reduce the risk of dislocation after surgery, we ask you to follow hip precautions for 6 weeks. There are 3 movements that you will need to avoid after your surgery. So the first one is about not bending your hip more than 90. So as I'm sat in this chair, my hips and my knees are at 90. So it's fine if you've got your hips and knees level or your hips a little bit higher. That would be great. The second movement is about not crossing your legs. So no crossing at the knees and no crossing at the ankles. So we want you sat with your feet facing forwards when you're sat in a chair. And then the other thing is about not twisting on your hips. So that's both when you're sitting and when you're standing. So you can reach out just to get things, but don't actually twist and reach at the same time. Because of the hip precautions, getting dressed is going to be slightly different than normal. So dressing your top half will be the same, but we don't want you bending down to your feet because you'll be compromising those hip precautions. So you will need to have some gadgets for getting dressed. So you'll need a grabber, helping hand, as we call it. You'll need a long-handled shoehorn. And then this is a gadget for putting on your socks. And I'll show you how to use all of those things now. So if I take my long-handled shoehorn to take my shoes off, keep it between my legs, and then I can just push that in and take my shoes off. Move those over to the side. So to put on your pants, you're going to dress your operated leg first. So I'm going to pretend that I've had my right hip operated on. So if you get your pants and you just lay them out in front of you, then you can use your grabber to hold onto them and then use the grabber as an extension of your hand. So down onto the floor, and then you can put your operated leg in. And when that comes up high enough, you can just reach that and let go of the grabber. Now, the other hip is not actually under the hip precautions. So if you've got the movement, there's no reason why you can't just lift your leg up. But chances are, if you've got problems one side with your hip, you've probably got a bit of pain and difficulty the other side. So just reposition your grabber, but it doesn't matter how much this leg lifts up. And then you can just lift it up like that. And then obviously just stand up and pull them up. So you dress your operated leg first, and you're going to undress it last. So to undress it, again, it doesn't matter how much this other leg lifts up, lift it up like that, and then you can just slide it off like that, nice and easy. Then to put your socks on, this is our sock gadget. So this works for pop socks as well. You're going to thread the sock on so the toe is at the top and then the heel goes at the back. Now this gadget can be a little bit tricky. I think it's great. So do have a bit of a practice with all 3 of the gadgets before you come into hospital. So there we are, there's the toe at the top and I've got the heel at the back here. And the little trick to do is where you've got this cord going across the back is just to get the top of the sock and just to take it over and under. And just by doing that, it just means that the sock comes off your foot a little bit later and it's higher up your foot. Use the cords to throw it down on the floor. Remember, we don't want you leaning down. Slide your foot in, and then you can wrap these around your hand, and you're literally just going to pull it up, and up it comes. Keep pulling, and it will come out the back. If it needs any adjusting, you can always use your grabber to readjust it. There's a little hook at the end that you can use. Then to take your socks off, nice and easy, use your long-handled shoehorn, just pop it back in the sock, and it should hopefully come off. And if it comes off on the floor like it does then, just use your grabber and you can pick it up. Then to pop your shoes back on, bring those over, Put this in the back, lift your foot up and obviously just slide it in. Having looked at hip precautions and getting dressed, let's get back to what happens in hospital on the day after your surgery. We call this day 1. You will be seen by one of the therapy team, and we will make sure that you are familiar with the hip precautions that we have just discussed. Initially, we will be aiming for you to walk with a Zimmer frame, and we will look at the way you walk. We will teach you some exercises that you can do holding the end of the bed or a windowsill, and we will demonstrate a safe way for you to get in and out of bed. You will need to take regular walks on the ward by yourself if you are safe to do so, or with a member of staff. You also need to do your exercises 4 times a day. As previously said, we don't consider you to be ill following surgery, but recovering from an operation, so we'll expect you to get yourself dressed. Day 2. Today we would aim for you to be getting in and out of bed independently. Depending on your walking prior to your surgery, we would aim to progress your walking from a frame to sticks today. If you have your own stick, we will check that it's the correct height for you. If you are only using one stick, then we would aim for you to hold the stick in the opposite hand to your operated hip. We will issue you from the local equipment provider the appropriate walking aid you need to take home. This will be on free loan to you. We would usually plan on practicing going up and down at least 1 step with you. If you need to be able to go up and down stairs at home, then we will practice this with you too and teach you the safe technique. If you have made good progress, then we will discharge you home today on day 2.
Our discharge criteria. The doctors will be happy with you. We call this medically fit for discharge. Your wound will be redressed if required. You'll be independent walking with an aid. Independent with things like getting yourself in and out of bed, getting yourself washed, and using your dressing aids. You'll also be safe doing a step to get into your home or the stairs if you require to practice them. Once you are home, if you have any concerns about anything you think might be related to your hip surgery, then we ask you to contact the orthopaedic specialist nurse as soon as possible. If you are phoning at the weekend or during the evening, then you will need to contact the on-call orthopaedic registrar. Both numbers can be found in the back of your total hip replacement booklet. Here are some things for you to consider once you are home. Remember, your hip precautions are for 6 weeks. Bathing. If you have a shower cubicle or wet room, then this is fine for you to use. We advise you not to use a bath or step into a bath to use a shower, as this will compromise your hip precautions. If you don't have a shower cubicle, then you will need to have a strip wash. Equipment. We encourage you to use any equipment that we have provided you with for the full 6 weeks and return it to the local provider when you have finished using it. If you look at the equipment, you should find a sticker with the contact details. Driving. If you're a driver, you will not be able to drive for 6 weeks. You can still travel as a passenger. In your total hip replacement book, you will find the technique for how to get in and out of a car. Before you resume driving, you will need to make sure you can perform an emergency stop without any discomfort or hesitation. Hobbies. Avoid hobbies that involve bending and twisting, such as golf, bowls, and gardening for 6 weeks, but you can still socialise with your friends. Work. Most people will need to have 6 weeks off work, but this will depend on the type of work that you do. If you return to work before 6 weeks, then you need to consider the hip precautions and how that may impact on you at work.
Once you are back at home, you need to carry on doing your exercises 4 times a day. Do pace yourself and take regular rests during the first few weeks, as you may tire quickly. Gradually increase your activity levels as time goes on. After 6 weeks, you no longer need to follow hip precautions and can return to your normal activities. Thank you for watching.